8.
We have a great show ahead, but first let's start with our top story. President Biden saying Thursday during a visit to the National Institutes of Health that the U.S. will have enough doses to vaccinate 300 million Americans by the end of the summer. You just heard Brad say that. There's a lot to unpack here, so let's bring in Tom Price, former Secretary of Health and Human Services and former Georgia Congressman. Congressman, we really enjoyed the conversation last time. Thank you for coming back. Welcome back. Let's start with this big news. Do you think the U.S. will be able to vaccinate the majority of the American population by the end of July?
Oh, I do think so, and I think it's incredibly important, and I'm so pleased that we have more doses to be able to get 300 million individuals to have both doses. The J&J vaccine, which is likely to come on board within the next couple of weeks, I believe, will also help, because that's just a single dose in order to get immunity. So that's going to be another big effective activity that will allow for the majority of the American people to get vaccinated. I think one of the big things that we need to think about, however, though, is that this disease is likely to become endemic, which means that we're going to need boosters. We need to be preparing for that and make certain that we've got individuals ready and willing and able to get booster shots, likely in the fall, but certainly for, I think, the next couple of years as we try to fight this disease.
Dr. Anthony Fauci predicted widespread vaccinations would start in April. He actually spoke to the Today Show on Thursday. I'm going to play that for our viewers, Congressman, and I'll get your reaction on the other side.
Sure.
If you look at the projection, I would imagine by the time we get to April, that will be what I would call, for better wording, open season. Namely, virtually everybody and anybody in any category could start to get vaccinated.
So can you explain open season? Do you predict that it will be just that, where anyone can go in and get vaccinated?
Yeah, this is kind of like, look at it like the flu vaccine that we get in the fall. You don't have to worry about whether or not the supply is going to be there. You just go to the pharmacy, or you go to your doctor, or you go to the health department, and you get a flu vaccine. And I think April is likely a reasonable time. I would hope that it would be sooner than that. And again, the J&J vaccine coming online may allow it to be sooner than that. But it's really important for individuals not to have to jump through hoops or over hurdles, or providers to be able to have to do the same kind of thing in order to simply get folks vaccinated. This is really, really key and important. And that's why the preparation for booster shots in the fall, for making certain that as we're going forward, we're fighting this disease with all that we can from a vaccine standpoint.
We're just 3 weeks into the Biden administration. How do you think the administration is dealing with COVID-19 thus far?
Well, I think they're doing all that they can, and I think that's incredibly important. I think the previous administration did a remarkable job in getting us to the point where, if you step back and you take a look at it, we have a new disease where we have, within a period of 1 year, a vaccine, more than one vaccines available for individuals to be able to get an immunity or to be protected from this new disease. So I'm encouraged by what I see. I think it's important to have the kind of single message, single unified message coming out of Washington. I'm heartened by the public health resources that are going to be available to not just at the federal level, but at the state level as well, so that we can get out in front of this. And it's really important. We're still playing catch up with this, and we need to be able to get out in front of it.
CVS and Walgreens among the more than 20 major pharmacies that have started to administer COVID-19 vaccines just this week. What do you think that means when it comes to expediting this rollout?
Well, this is really key because, as I mentioned, if you compare it to the flu vaccines in the fall, we at our height are able to provide 3 million vaccine doses a day in the fall, and that's primarily done through pharmacies, through local hospitals, through local providers. But all that infrastructure is already in place to be able to provide 3 million vaccine doses a day. So getting CVS, Walgreens, Walmart, all of the individuals pharmacies that are able to do so up and running is going to be key to making certain that we get to that point where all Americans that desire and want a vaccine are able to receive one.
I do want to ask you about the White House's aim to bring students back to the classroom, inside their classroom full time, but is deferring to the CDC for guidance. What is the best way to accomplish this goal safely, Congressman?
Well, those guidelines are out there, the public health guidelines for getting schools open, and we absolutely must reopen schools, but they've got to be reopened safely. So you have to make certain that mask wearing is in place, social distancing is in place, hand washing is in place. You make it so that individuals who are sick don't come to school, either teachers or students. But I'm curious about one thing, and that is that society has already given us a comparative analysis of what occurs when you open schools, and that's through parochial and private schools. And I haven't seen any data on the effect that the disease has had on the reopening of those schools or the opening of those schools. Many of them have been open since the fall. There are some public schools systems in this country where they haven't had students in the classroom for almost a year now. So how's it look in individuals that are actually making it work? And when we do that, then I think we'll be able to have the guideline and the template, the model, to be able to get everybody back in school, which is absolutely imperative.
The U.S. is working on trying to get the economy back on track. You know, stimulus talks are ongoing. Are we there yet in terms of the vaccine rollout to reopen major cities?
Well, I think we are, but it varies depending on where you are, and that's why you have to look at this transmission rate, this R rate that is talked about. But in many areas, it is possible now to be able to reopen in major ways. Again, respecting the public health guidelines, the social distancing, the masking, the hand washing, staying home if you're sick. And the more vaccines we can get out there, the more individuals we can get vaccinated, then the more assurance we'll have that the likelihood of seeing these spikes that we've seen with the disease over the past year not occur in the future.
The president has been talking about ramping up coronavirus testing. The question I think that so many of us are asking is, should testing have been ramped up already before the vaccination rollout? Don't these two things go hand in hand?
Well, they do, and I've been pushing for over-the-counter testing. It's possible now to, like individuals get tested for certain diseases, or even a pregnancy test that's just over-the-counter that you can do in the privacy of your own home. We ought to be able to have these testing availability throughout the entire country, because the more you're able to test, then the more individuals are able to make wise decisions about what they're doing in their life. Maybe I won't go to work that day. Maybe I'll quarantine at home. I'll isolate at home, or our kids will isolate at home, depending on what the results of that test are. It's also easier to do contact tracing when you have available testing. So testing is really important, but it's not exclusive of treatment. It's not exclusive of the other public health measures. It's not exclusive of vaccines. This is, again, the constellation of what has to be done from a public health standpoint to beat a new disease.
We always appreciate your insight and experience, sir. We hope you come back. Tom Price, former Secretary of Health and Human Services and former Georgia Congressman. Thank you again. Coming up, what does